Polycystic ovarian syndrome is a hormonal condition that affects at least 1 in 10 women. It appears when the body has an imbalance of reproductive hormones, but since this issue can cause a whole range of symptoms, Dr. Laura Shaheen says it's often underdiagnosed.
It is not a black and white diagnosis. It's a collection of signs and symptoms. It often presents with irregular and unpredictable menstrual cycles due to irregular and unpredictable ovulation. And that's a part of the hormone imbalance. Two other things that are often associated with it are clinical or laboratory findings of elevated androgens or male hormones. We all have both female and male hormones, but in PCOS, it's a little bit balanced towards the androgens or the male hormones,
which can cause acne, thick hairs on the mustache and chin areas, and even male pattern baldness. Shaheen is a double board certified OBGYN and reproductive endocrinologist at Pacific Northwest Fertility. Another sign of PCOS is a higher than average egg supply.
So you can look at the ovaries on ultrasound and see all of these little follicles, kind of more than you would expect for someone at a certain age, or an elevated blood test called anti-Müllerian hormone, or AMH, kind of above average for what you'd expect.
Most women are born with all the eggs they'll ever produce, around 1 to 2 million at the time of birth, and that includes those with PCOS. The difference is that during ovulation, the typical 10 to 15 eggs available to be fertilized drastically increases for women with PCOS.
They might have 20, 30, 40, 50 follicles that are kind of up for grabs, visual. That's why their AMH is so much above average or higher. It's like all these little follicles or eggs are kind of fighting to be the one to ovulate. And that's one of the reasons that the ovulation is off, because they get kind of confused. And so if you're not ovulating on a predictable timeline, you could have really unpredictable menstrual cycles and only get a period 3 or 4 times a year.
This unpredictable pattern is part of the reason why so many people think that having PCOS causes infertility. Shaheen says that while it doesn't cause infertility, it can make conceiving more difficult because ovulation may only happen a few times a year.
It's difficult to time trying to get pregnant if you aren't actually sure when you're ovulating. And I just really want to clarify that so many people are told within the same sentence of getting the diagnosis, like when they're teenagers or in their 20s, you have PCOS, you are going to be infertile. And I just wish there was more education at that point, or kind of understanding that it could impact fertility. But as long as you can ovulate, there's sort of simple things that we can help as far as a fertility doctor or reproductive endocrinologist to help people ovulate on time. If you're just ovulating regularly, you still have a very high chance of getting pregnant. It doesn't have to be just awful sort of, I've had people tell me, oh my gosh, when I got diagnosed, I was told I wasn't going to be a mom. That is horrible. That is absolutely not true.
It just means that the journey may take some more time and resources in order to figure out how your specific body works. Shaheen says that before turning to medications, which are helpful options, she tries to help her patients optimize their life for health.
You can learn your body and learn how nutrition can help you and how moving your body can help you, and then get the signal of more regular ovulation, because PCOS has long-term health impacts like increased risk of cardiovascular disease, insulin resistance, diabetes. So there's really great kind of positive things to share. Like, you can move your body 3 or 4 times a week with pretty low impact, kind of 30, 40 minutes. And without using exercise to say like, oh, you need to lose weight to, be healthy with PCOS, just moving your body without a change in a scale, like a number on a scale, that can help people start ovulating.
Movement helps reduce insulin resistance and allows the hormones to communicate more effectively. And in line with most other health tips, eating whole foods and limiting consumption of ultra-processed foods can only help. Shaheen often has her patients work with a nutritionist to find the best plan to balance their lifestyle.
It's not a quick fix, but it's sort of taking a look at all of these things to hopefully help. There are some supplements that have been shown to really help with PCOS. inositol, which is basically like a sugar in our body. It sort of can act like an insulin sensitizer, again, to help with decreasing, this stress on the body and help insulin work better to help with ovulation. But definitely work with a provider, be careful where you're buying supplements and get the right thing. And, there's a lot of things that can be done.
Another tool that can help, but is often misunderstood, is birth control. Shaheen says these pills can mask the symptoms of PCOS since it evens out the body's hormones. However, she often sees myths online from people claiming that birth control causes PCOS.
Where that comes from is people will stop birth control pills for whatever reason, but very common in my practice is they stop it because they want to get pregnant. And then they're not getting their periods, the acne comes back. They go to the doctor, a new doctor, because this is a decade later, and the doctor diagnoses them with PCOS, doesn't explain why the birth control pills masked the symptoms. And then they'll read an Instagram post that says the birth control pills caused your PCOS, and now I'm going to sell you a supplement to, make it all better. But it's those evil birth control pills. Birth control pills are not for everyone, but they really can be so helpful in certain situations. And a lot of people with PCOS are just, their symptoms are better. They're so much happier on them. Doesn't mean that they have to take them, but just that misconception that they cause PCOS is not true.
If you're wondering how these myths can be so prominent in society, it's because there's still a lot we don't know about this condition. Shaheen says that her own medical education barely touched on PCOS. In fact, all of her knowledge comes from a personal sense of responsibility to stay up to date on the latest research. Otherwise, she'd still be treating her patients with outdated knowledge from 20 years ago, which is sadly a common practice for many physicians. These old-fashioned methods are part of the reason why PCOS goes undiagnosed in many women.
The person that was in my textbook when I learned about PCOS was a little bit overweight, had acne, and was not getting periods. And I was taught, again, this is a long time ago, that is PCOS. So there's a lot of people that have, I think of it like a spectrum, like people will not have any difficulty losing weight. And the only way it shows up for them is irregular ovulation and maybe a high egg count, but they don't have any of the sort of androgen things that show up like acne or something like that. And other people, it can show up in so many different ways. If it's not on your radar, if you're not thinking about it, you could definitely miss it.
Shaheen dives into more of the issues surrounding PCOS and fertility on her podcast, Baby or Bust. You can find more information about this condition, Dr. Laura Shaheen, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.